Sarah was a tech activist, a very brave woman. We first met her in the middle of 2001 when she was very sick with AIDS. Tragically, Sarah died in April of this year. And discrimination, if you like, followed her even past her death. Sarah was a member of something called AVBOB, which is essentially a company which sells funeral policies. And it's a company which targets poor people and black people predominantly, and people pay a monthly premium, usually about 50 rand. I think in Sarah's case it was 50 rand. And if that person dies, then the company pays the costs of the funeral, they pay the costs of the coffin, and so on and so on. What the company doesn't explain properly to people is that if you die of AIDS, or if the company thinks that you've died of AIDS, then they will not pay out on the funeral benefit.
Ntateno o re boleletse hore mo eno moraka ha soka a qeta trial ya 6 months jwale ha bano mo patela a re botsa hore na mofu o tshwere ke ra mo bolella a re ha ba mo pate ka 6 months wa HIV ba mo pata ka 3 years baba ba re ha ene le hore ka 6 months ena o chaisitswe ba ne batla mo pata e seng ha hlokaetse a kula hobane eno moraka o mo joinisitse mohlomong a sa bona hore wa kula.
Well, each policy is different. That's why one can't advise the patients in general. Some policies pay out for people living with HIV. Some policies say only if you get diagnosed after taking out the policy. A lot of policies put in a clause like 6 months after you've taken out the policy, you may not fall sick with HIV. For me, the whole concept is wrong. That somebody who's got an illness gets discriminated against it because of it is a specific illness. For me, everybody, if they take out a policy, it's because there's a risk of dying, and whether they die of a car accident or of a pneumonia or a heart attack, I think the policy should treat it equally.
Avanza stupu kala bohlano ha re emetse hore batle ha batla Saturday o seng ha mofua patwa ke ha re nka tšhelete re ya re lo ba kopa hore ba mpa ba lokolle stupu re ne re nkile tšhelete kana ka 5,000 ba re ha re ntsha 4,700 and something ba tla ntsha stupu seno re tlo se pata.
After Sarah's death, there was an attempt to get cover to cover the costs of her funeral and so on, and the company to this day has not actually paid that money over. After you die, your body is impounded, if you know what I mean. The company almost comes and takes the body. An AFBOB undertaker takes the body, and to get that body back, you have to pay the costs of the undertaker, you have to pay the costs of the coffin, and so on and so on. So you almost have to buy your own body back in order to be buried.
What's that about for you to stop from the start and I'm to join Habamo Bulele or na Basoka Batuba, Siki, Janka Pobatuna and Tujuan, Bangonisa Batu fail. Basoka Chelte a cash. Or Mutuan look at the Siki, if you barrel Miana, who like a blowing to Filabata or Narizba Red Bui, or now Tumble Linky, so Rabalella or Mutun, took over HIV. Barona Nanoka Gayana Rabajuet and open a Sunday is 8 months. I join in trail. Listen till 8 months sick of Fela Sansa I join in. So Makaleta Catazia last about Port Gowrie. I was a honor 7 days. Baba like killed the egg cash. And I beg over you to stop look a hole. Sell Catilo preparing in Twengulangu or into the Lugia Baba Sansa Baljosa last. I could tell it to Bangatabaki by a moo. Labatolo, how about a lojo in a moo? o bue o botse ntho engwe le engwe o ska dumela fela ba ngodise fela hoba nga tsatsi la dilase ba tla o phoqa ka tsatsi la dilase hobane ha ba botse motho gona maemo a motho na a jwang.
We sometimes face a problem with death certificates. The problem is confidentiality. We have introduced 2 death certificates now where the doctor fills in both. The first basically just says the patient died of a natural cause. Then there's a second death certificate which is used by the National Department of Health for statistical purposes, on which the doctor writes the diagnosis of which the patient passed away. Let's say it was TB. And then the doctor also fills in if there were additional problems, where the doctor then writes in HIV. The second document, after you fill it in, you put it into an envelope and you hand it with the public document to the family or to the undertaker. And it is the responsibility of the undertaker to take that sealed envelope to Home Affairs Department because it's a confidential document. A week later, the insurance company comes in and says they want to investigate the folder of the patient because they know the patient had HIV and they want to see what is the story because they don't want to pay out the policy. And it has happened to me that I asked them, but how do you know the patient had HIV? And they showed me a photocopy of that confidential report that I sent to Home Affairs. And I said, where do you get this? And the insurance company said, we got it from the undertaker, which for me is a breach of confidentiality because I, as a doctor, am forced to write HIV onto that second death certificate. But the undertakers don't treat it as a confidential document.
The bereaved team have tried for 4 weeks to secure an interview with AVBOB. They refused to talk to us. We received an anonymous letter from AVBOB reading as follows. All clients found to be HIV positive, usually via LOA records, shall have his or her applications for assurance declined by AVBOB. AVBOB used to have an AIDS exclusion clause that allowed the company not to honor any AIDS-related claims. This clause was removed in January 2002 from the AVBOB policy, but still appears in all assurance applications currently being used by the sales representatives. The AVBOB policy contract issued to all clients does not inform them of AVBOB's stance on AIDS. It is for this reason that most people cannot accept or understand why their funeral claims are not paid out.
This is wrong. As far as we're concerned, it is unlawful. We haven't brought a case to court yet, but it is our intention to try to challenge these practices and try to argue that these practices are unlawful and that in fact they are unconstitutional. And it's something that the AIDS Law Project is investigating